I'm Bob Wise, President and Chief Executive Officer of the Hunterdon Healthcare System.
And I'm Dave Knowlton. I run the New Jersey Healthcare Quality Institute, and I'm the co-lead for the New Jersey Action Coalition in nursing.
And I'm pleased to be able to spend some time with Dave to talk about a very important healthcare issue here in the state of New Jersey, the matter of the need for nurses and the role of the New Jersey Action Coalition in being able to achieve the goals that the Institute of Medicine has set for us to help us solve some of the many healthcare problems we'll be dealing with in the next years to come.
You know, it's a different time in healthcare. Reform has started. Suddenly, we're getting huge changes in the healthcare delivery system. 10,000 people a day are turning 65. Chronic disease is on the increase. Nurses are critical components to everything that's being done in healthcare in New Jersey on an outpatient basis and in all of our hospitals, like all of you are running.
The transformation of healthcare that we've seen in the Affordable Care Act is challenging hospitals to expand beyond its walls. And that means the need for more nurses, not only in acute care settings, but in nursing homes and healthcare environments where they didn't exist before, like Walmarts and CVS's, where we're seeing the need for responses to a role that has grown in healthcare reform, covering more patients than ever, the possibility that 32 million more Americans will need health care under health reform insurance coverage means that we need more nurses.
And I think the real challenge that we'd like to give to all of you is not that you should recognize nurses. I'm sure you've learned from your work as members of a board of trustees. I chair a hospital board, and I know my colleagues believe in the importance of nurses, and you all know them and you recognize them and you know the care they give. I want to talk to you about a different component of nurses. The nurse is the leader. And I would say to each one of you that your boardroom, your board table, should have a nurse and a seat at that table. If you're going to hear the voice of the patient that's so critical to improving healthcare, nurses are a valued and valuable addition to your hospital board. And one of the objectives I want to see for the Action Coalition is that every hospital board in New Jersey would have a nurse sitting on the board.
And it's really unfortunate that only 6% of hospitals across the country have a nursing representation. And one considers how important the nurse is to the healthcare team and how much the nursing care extends into the community. In order for a hospital to fulfill its mission objectives, one can't imagine meeting those objectives without nursing governance and nursing leadership.
And as in my day job, as I said with the Institute, I deal with the issues of safety and quality. And Bob sits in a Leapfrog A hospital on the Leapfrog safety score. Some of you have gotten those scores, some of them good, some of them not so good. Nursing is the pivotal vehicle to changing those scores, to making those scores positive, to improving the quality of care that's delivered and the safety of that care delivered to New Jersey citizens. Their representation on the board, their recognition by this board, and their ongoing participation as we go through reform is going to be critical as we move New Jersey forward.
Hospitals today are being challenged by meeting certain goals that the federal government has set, the state of New Jersey has set. Penalties are being applied if those goals aren't met. Many of those goals can be met only by nursing involvement, reducing infection rates, falls from beds, the ability to immunize the whole population. They involve nurses more than any other profession, and that argues for more nurses, more qualified nurses, to be able to carry them out.
So that's our message. We would like to see more nurses on boards. There's no reason why New Jersey can't be 100%. And we certainly are willing to talk further with you if we can be helpful in your achieving that objective.
It really is up to you. It is part of your fiduciary responsibility, and we encourage you to act now.